Hi, my name is Brittany Vasquez, and I'm going to be showing you how to effectively prepare for a blood draw procedure. So you just had a patient who has orders to get their blood drawn. Your patient is probably thinking three things. I hope that the person doing this knows what they're doing. I really hope that this doesn't take a long time. And I hope I don't have to get stuck more than once. To make sure that you are well prepared, you want to do three things. You want to select appropriate site, you want to gather the right equipment, and you want to find a good vein. If you can get these three techniques down, your procedure will go a lot easier. So veins run throughout the entire body, but what I want to do is select the most appropriate site. That's going to be the antecubital site. The reason I'm choosing the antecubital site, or this fold in the forearm, is because it's the site that's going to cause the least amount of pain. Its veins are large enough to support most needles. The veins are closest to the skin, and it has the lowest risk of nerve damage. So when I'm selecting the site, I also want to look for no-go signs. Some of my no-go signs are going to be edema or swelling. It's going to be redness or irritation, signs of infections, or any scar tissue like burns or trauma. I'm also looking for signs of previous surgery or possible nerve damage. One of the easiest ways that you can figure this out is just ask your patient which arm do they normally get stuck in. Most patients will tell you, hey, I have a good arm and a not so good arm. So after I selected the appropriate site, I want to make sure I gather the right equipment. Most blood draw techniques are going to require the same equipment, which is going to be an alcohol swab to clean the site, your venipuncture or blood draw equipment like your needle and syringe, and this right here, our tourniquet. So what this tourniquet is going to do is it's going to cut off circulation to apply enough pressure to the arm to make the veins protrude. So how I'm going to do that is I'm going to pull this nice and tight, about 3 inches above the site, and I'm going to take a tail and I'm just going to tuck it underneath where I crossed it. So now I have a nice and secure tourniquet that can be released at just the pull of a tab. When my tourniquet is applied, I'm going to have my patient pump their fist a few times to help build up that pressure and really make those veins stick out. Now I have to find a good vein. Some things I'm looking for a good vein is a vein that does not look angry. When I say angry, I mean I want to avoid veins that are tortuous and winding, or they look really busy. So if they look like highways that are crossing, you really want to avoid those veins because those are not good. I'm going to take my finger and move side to side over the site to palpate or feel for a vein. Once I feel something that I think may be a vein, I'm going to bounce it or push down on it to see if it's either rigid or cord-like or bouncy like a rubber band. Bumps that feel rigid or cord-like are probably not veins. Those are most likely tendons, so you want to avoid those. If it feels bouncy like a rubber band, that may be a good vein. My last and final sign is I'm going to look at the size of the vein. If the vein looks large enough to support the shaft of the needle, I may have a good site. So now it's the fun part, and I can stick as appropriate. This is going to take time. These techniques are going to take time. Remember, it's going to take a while for you to get comfortable, but the more that you do it, the better you'll be at identifying right sites, getting the right equipment, and finding the right vein. Always remember that practice takes perfect. Thank you.